Botox and fillers. These are the words on many minds. These are the requests I hear daily. When can I have it? When will you do it? The answer is much more complicated than it may seem. First, I will explain why, and then I will explain what we're going to do. You may be wondering, why is the answer so complicated? Imagine you're on a seesaw. On one end sits laws and mandates, the rules the governor imposes, and the guidelines experts at the American Academy of Facial, Plastic, and Reconstructive Surgery recommend. On the other end sits risks, the risks to your safety and to the safety of doctors, staff, and other patients. In the middle is freedom, the choice to have Botox, fillers, and other procedures. For you to determine when to have your Botox and fillers, you need to be educated about risks so that you can determine a risk that's acceptable to you. For me to provide you with Botox and fillers, I have to be confident about acceptable risk to you, to me, to my staff, and to other patients. So let's take a closer look at law and mandates. These are the facts in New York. As of May 28th, Governor Cuomo's executive order continues to forbid elective cosmetic treatments, visits, and procedures, and surgeries. Sneaking Botox or filler into a visit for another reason is still against his executive order. The AAFPRS recommends that when permitted to resume elective visits and cosmetic treatments, both the patient and the doctor should be wearing a mask for the entire duration of the visit. So if you're thinking, hold on to that thought for just a moment. Let's look at risk and safety first. You probably already know that COVID-19 can spread through droplets emitted from coughing, sneezing, and even speaking in patients who are asymptomatic carriers or have been exposed for up to 14 days before they develop symptoms. It can also be spread from patients who've recovered from COVID-19 symptoms for up to 6 weeks after their symptoms are gone. It can be spread by patients regardless of whether their antibody test is positive or negative. Did you know that COVID-19 risk increases with exposure? That means the greater number of virus particles that you are exposed to, and the longer time you've been exposed to those particles, the more likely you are to become infected with COVID-19. And lastly, did you know that when a person removes his or her mask in an exam room, that COVID-19 particles can live in the exam room air for an unknown period of time? Now that you understand the laws and the risks, you have the freedom to decide if you want to have a treatment in accordance with your own risk tolerance. But it's my job to reduce the risk that you're exposed to in so much as I'm able. So here's what I'm going to do in my office. First, we will only open when the governor's mandate allows for elective cosmetic surgery, visits, treatments, etc. And we will reopen in 2 phases. During phase 1 of our reopening, we will follow the AAFPRS guidelines and offer only those treatments that can be done when both the patient and the doctor are wearing a mask. For example, Botox of the forehead, crow's feet, or neck. We will screen all of our patients by phone for risk at the time of the appointment scheduling and provide instructions for the visit and a consent form for all visits that occurred during the pandemic. This consent form must be returned electronically in order for your appointment to be confirmed. You will be asked screening questions, again, 24 to 48 hours before your visit when your appointment is confirmed. If you would like to speak with me about anything other than the actual treatment itself, you will need to do this in advance via telemedicine so as to reduce our face-to-face contact time. And if you're a new patient, all forms will be sent to you in advance to be completed and to be returned electronically. The first part of your visit will be conducted via telemedicine again to reduce face-to-face contact time as well. Follow-up visits after your treatments will be conducted via telemedicine when possible. You will notify us by phone when you are in the vicinity of the office, and we will ask you to wait outside until we can invite you directly into your appointment and into the treatment room. When you arrive at your appointment first, please wear a mask. You must leave it on at all times that you are in the office. Your temperature will be taken via touchless measure, and if your temperature is 99.5 Fahrenheit or higher, you will be asked to leave and reschedule your visit. You will also be asked to put your phone away at the door for the duration of the visit, and you'll be given hand sanitizer and asked to clean your hands. Then, you will be escorted directly into the treatment room, and you will be given an ice pack for your treatment. Please arrive alone. Minors will be granted permission for one adult to accompany them, and we apologize in advance, but babies, pets, and other adult visitors will not be permitted in the office. Once you receive your ice pack for your treatment, please keep it on your lap away from all surfaces, and please take it with you when you leave after your visit. There will be a HEPA filter in each exam room, and the window will be left open between patients to further allow for air exchange. The exam room door will remain closed during and between treatments, and no patients will be able to enter the exam room for 20 minutes between visits. The staff and I will be wearing scrubs, masks, hair covering, gloves, shoe covers, eye protection, and face shields, and we will perform deep sterilization of all surfaces and door handles before, after, and between patient visits. We will also use UV light sanitization, and we apologize in advance, but bathrooms will be reserved for staff use only. Invoices will be sent to your email address at the end of your visit prior to your leaving. You will then be permitted to retrieve your phone at the end of your visit in order to make payment directly through a link in your email that is secure and allows for touchless, contactless payment at the end of your visit. In phase 2 of our reopening, we will begin this after we've established 3 weeks of safety during phase 1, and that means no uptick in increased number of COVID patients. Once phase 2 begins, all other procedures and treatments and surgeries will be offered. But note that during phase 2, I will be wearing something called a PAPR, a positive airway pressure respirator, for all procedures that require the patient to be without a mask. This is because types of procedures that are done without masks can generate aerosolized particles that can be an increased risk to me, the staff, and other patients. So therefore, we will also limit the number of patients who could have these types of procedures each day, and we will increase the amount of time between patient visits. As we confirm the safety of phase 2, we will obviously relax these guidelines and rules as well. Please know that we are following the strictest safety precautions that we can, given the limited knowledge that we have about COVID-19. Although we do our best to minimize risk, no risk can be fully eliminated. If you prefer to be even safer, we will continue to provide you with consults and visits via telemedicine, and stay tuned because we plan to offer facial rejuvenation at-home procedures soon. Stay safe and be well.